Production and components of the second sound. The closure of the aortic and pulmonic valves contribute to second sound production. In the normal sequence, the aortic valve closes before the pulmonic valve. A good rule of thumb to remember is that left-sided mechanical events normally precede right-sided events. The aortic, A2 component of the second sound is the loudest of the two components and is discernible at all auscultation sites, but especially well at the base. Since it is a high-frequency sound, it is best heard with the diaphragm of the chest piece firmly pressed. The pulmonic, P2 component of the second sound is the softer of the two components and is usually only audible at base left. Its high frequency is also best heard with the diaphragm of the chest piece firmly pressed. A physiological split occurs when both components of the second sound are separately distinguishable. Normally, this split sound is heard on inspiration and becomes single on expiration. The A2 and P2 components of the physiological split usually coincide or are less than 30 milliseconds apart during expiration and often move to around 50 to 60 milliseconds apart by the end of inspiration. The physiological split is heard during inspiration because it is during that respiratory cycle that intrathoracic pressure drops. This drop permits more blood to return to the right heart. The increased blood volume in the right ventricle results in a delayed pulmonic valve closure. At the same time, the capacity of the pulmonary vessels in the lung is increased, which results in a slight decrease in the blood volume returning to the left heart. With less blood in the left ventricle, its ejection takes less time, resulting in earlier closing of the aortic valve. Therefore, the net effect of inspiration is to cause aortic closure to occur earlier and pulmonary closure to occur later. Thus, a split second is heard during inspiration and a single second sound is heard during expiration. Listen to the following second sound. The second sound will be split upon inspiration and usually will be heard as single on expiration. The physiologic split second is heard best at base left with the diaphragm chest piece. The following example represents a second sound splitting interval of 25 milliseconds. Now, listen to a second sound splitting interval of 50 milliseconds. Now, listen to a second sound splitting at 75 milliseconds. The following example represents a normal individual with normal respiratory variation, or physiological splitting, of the second sound. The next example is also that of a normal individual. The recording is from base left. A physiological splitting is heard with each inspiration. Breath sounds are heard in the background. A reversed, paradoxical split of the second sound occurs when there is a reversal of the normal closure sequence with pulmonic closure occurring before aortic. During inspiration, the second sound is single. and during expiration, the second sound splits. This paradoxical splitting of the second sound may be heard when aortic closure is delayed, as in marked volume or pressure loads on the left ventricle, i.e., aortic stenosis, or with conduction defects, which delay left ventricular depolarization, i.e., left bundle branch block. Listen now to a paradoxically split second sound in a patient with left bundle branch block. Respiration is heard in the background. The split will be audible during expiration, and the second sound splitting will be narrow or become single during inspiration. The paradoxically split second sound is heard best at base left, with the diaphragm chest piece. Abnormally wide split second sound. The normal physiological split second sound can be accentuated by conditions that cause an abnormal delay in pulmonic valve closure. Such a delay may be due to increased volume in the right ventricle as compared with the left, atrial septal defect, or ventricular septal defect. Chronic right ventricular outflow obstruction, pulmonic stenosis, acute or chronic dilation of the right ventricle due to sudden rise in pulmonary artery pressure, pulmonary embolism, electrical delay or activation of the right ventricle, right bundle branch block, decreased elastic recoil of the pulmonary artery, idiopathic dilation of the pulmonary artery. The wide split has a duration of 40 to 50 milliseconds compared to the normal physiologic split of 30 milliseconds. It is heard best at base left with the diaphragm. Listen to the following widely split second sound. The split will be taken out occasionally to allow you to compare the normal with the abnormal.